My name is Cedric Jackson. I'm a nurse practitioner student, and today I'll be performing a musculoskeletal exam. This is my patient. Could you please state your first and last name and date of birth?
Tori Jackson, 5'15",
Can you tell me your gender that you prefer?
female,
Also the race that you...
African American.
Okay. So first thing is assessment. I'm going to examination. I'm going to start by inspecting her hands. So if I can see your hands out, please. So I'm just looking at inspecting her hands for any deformity or discoloration. Looking here. Also, I'm just going to inspect her wrist as well for any deformities or any discoloration. Then I'll go in. I'll start to palpate her hands. Just palpating for any nodules or any pain on palpation.
No.
Okay. I'll palpate the fingers, making sure to palpate both the proximal and the distal joints of the fingers. Again, palpating for any nodules or any pain on palpation.
No.
Okay. Next, what I'll have you do is I'm going to check the range of motion of your hands, of your fingers. So if you could first close your fingers, which that is adduction, and if you could open your fingers, that's abduction. Okay, could you make a fist for me? Perfect. Okay, and turn your hands over on top like this, and just open your hands up. Now flex your hands down. All right, and extend them up. All right, and one test that I'm going to perform on the next, we'll go into palpating the wrist. So I'll palpate the carpals of the wrist. Again, palpating for any pain on palpation. Perfect. Palpating for any nodules. We'll check range of motion of the wrist. So it's similar to what we did with the hands. So first I just want to take your wrist and just flex them down and extend them all the way up. Perfect. Hold your hand up straight out like this. And I want you to take them away, which is abduction, and bring them back to the center, which is adduction. Perfect. Next, there's a special test I'm going to do of the wrist, which is the Teno's test, Teno's sign. So we'll take your wrist and we'll just hyper-extend it out. And I'm just going to palpate the median artery here. Sorry, not artery. The median nerve. Any pain or numbness felt in your lower hands, or
No.
are you feeling any numbness? Okay. So if she was feeling any pain or numbness, especially in the palm of her hands and the index finger and the middle finger, it's positive. That's a positive Teno's sign. The next test we're going to do is the phalanx test. So I'm going to have you take your hands, go in prayer position, press forward for me, and I will have her do this for about 40 to 60 seconds. So we'll just have you release. And release any pain and numbness in your hands.
No.
Okay. And if she was having any pain and numbness, that is a positive phalanx test. From the wrist, we will move up to the elbow. So again, I'll just inspect the elbow. Just looking again for any discoloration, any deformities. I'll go in and palpating the elbow. I will start with the palpating the olecranon process. Also palpating the lateral condyles and the medial condyles. If the patient had positive pain on the medial condyles, that's positive for golfer's elbow. If pain was on the lateral condyles, that's positive for a tennis elbow. Next, we'll work on range of motion of the elbow. So we'll start with we'll flex your elbow up, and then extend it. Then do it on the other arm as well. So flex and extend, perfect. Then we will pronate, which is place your hand palms down, and supinate, bring it up. Do the same thing with the other hand, pronate and supinate. Perfect. Any pain or discomfort doing that?
No.
Okay. From the elbows, we'll move to the shoulders. Then again, I'll just begin by inspection. I'll inspect the shoulders, inspection for any discoloration. Again, in a clinical situation, her top will be removed. If there was any problems, if her problems coming to the office was pain with the shoulders. But again, just inspecting the shoulders, inspecting for any discoloration or any deformities. Next, I'll go into palpating. I'll palpate start palpating around the supraclavicular area. Also, I will palpate, palpating the acromial clavicular joint. Moving over to the subdorsal bursa. Feeling for the corticoid process. Also palpating the tubercles of the humerus, and also the bicep notch there. Checking for range of motion of your shoulders. What we'll have you do first is, so we'll flex your arm forward, and then you flex it, then you extend it all the way back. Good. Do the same with the other. Flex forward, then extend all the way back. Good. So another exercise is going to be just abduction. So what we'll do is we'll take your arms out, shoulders out. So that's abduction, and bring them in like this. Good, that's abduction. So out again, abduction, and bringing them in is abduction. Abduction. Add is bringing in, ab is take out. So the next thing we'll do is check for, let's say, one of the tests, there's a special test you can do to see if there's any type of rotator cuff injury. So what I would do is have you like you going into abduction of your arm here. So again, and I would extend it up and kind of rotate it back. And if you were having pain there, that's a positive Hawkins sign, and it is a sign that it could be a rotator cuff injury. So from the shoulders, we'll move on to the neck. So I'll begin by just inspecting the neck. Just inspecting for any discoloration. Also, I'm inspecting for any deformities. I will then palpate the neck. I will palpate, I'll palpate the cervical spine, also the paracervical muscles, the trapezius, and also the rhomboids. Also, I'll have you open and close your mouth for me. Perfect. Any tenderness there? Positive though. Just checking for TMJ tenderness. Next, if you could just open your mouth for me real wide. Good. Any pain or tenderness when you open your mouth? Okay, could you open your mouth for me again and kind of move your jaw around? Good. Any pain or tenderness doing that? No. Okay. Perfect. So next. Next, we'll check range of motion of the neck. So I have you flex your neck down to your chin and extend it back for me. Also, lateral motion, if you take your right ear and place it towards your right shoulder, left ear towards your left shoulder. Any pain or discomfort doing so? Okay. Good. Oh, a specialty test that we'll do for this is the Sperling's test. And I will stand behind the patient. Oh, I'll come back this way. If you could turn just slightly, perfect, just like that. So I kind of turn the head a little laterally here, holding her shoulder, and gently apply a little pressure to her cervical spine. Are you having any pain or any numbness or tingling?
No.
That would be a positive Sperling's test if she was having those type of issues. From there, we'll move down to her feet, and I'll adjust the camera a little bit here. So if you straighten your feet out, so again, I'll just begin by just inspecting the feet, just looking for any discoloration, any deformities. Then I will palpate the feet, palpating the bones of the feet there. Also palpating the toes here. Also the joints of the toes. Any tenderness on the joint. Okay. If she was standing or walking, I would check the her arch here, seeing if she would, possibly was flat-footed when she's coming in. Her arches seem to be fine. Next, we would go into range of motion. So I would have you first we'll invert your foot in and invert, extrovert, inversion, and exversion. Heel the feet here. Okay. And that was actually your ankles that we were doing inversion, exversion on. So with your sorry here. Okay. So could you just flex your toes, curl your toes for me? Okay, and extend them. All right, good. So again, we checked the ankles, we checked range of motion of I inspected the ankle. Again, checking for any deformities or any swelling. Also, any discoloration. Then I would palpate the ankle again. Checking for any nodules. Doing the same on the opposite foot. Again, checking for range of motion. So if you could like rotate your feet in a circle there for me. Any pain while we're doing that? Okay. So we did inversion, exversion of your foot there. Also, we will plantar flex and dorsiflex your foot. So plantar is like you're pressing the gas pedal in the car, and dorsiflex is bringing it forward. Any pain doing that? Okay. So then we'll move to your knees. Again, in a clinical situation, we would make sure that her knees are exposed and I'm able to see them. But again, I would just inspect them for any discoloration, any swelling there. I'll begin by palpating the knees, the suprapatellar pouch, sides of the patella on both knees. Also, posteriorly here, if you're feeling a lump or so, that could be positive for a Baker's cyst. All right. So we will check for flexion, range of motion, check for flexion of the knee. We'll have you, I guess we have you lie back here. So we extend it, we'll flex the knee down and flex it forward, flex it, extend, flex and then extending the knee. Any pain there?
Yeah.
Also, we'll do the same with this one. We'll extend it and flex the knee there. Okay? All right. So you can sit up for me. Again, let's do the drawer test too. Wait, let's go back down. That's one of the tests we could check here on the knee here, and that's by having the knee slightly flexed and pushing it forward, and then pulling it. And you do that the same on both sides. And any pain, so it could be positive for some type of injury or so to the knee. All right, from the knee, we'll move up to the hips. Again, we'll just inspect the hips. It's probably easier if you were just inspecting the hip, just inspect for any discoloration, any swelling, any deformities there of the hip. So again, I'll have you lie down on the table for me. Have you scoot up towards the top here. Get your feet off the table completely. Okay. And now I'll find the ASIS, the anterior superior iliac spine, and palpate there. I'll do that on both sides. All right. And then palpating the greater trochanter. Probably easy if you turn on your side, on your chest a little bit. The greater trochanter here. Also the posterior superior iliac spine. All right, and I will see if you could do some active range of motion or so to your legs here. So abduction, we'll have you bring your leg out towards me, and adduction we'll have you bring back in and kind of cross it over your foot there. Perfect. Could you do the other side as well? So abduction and adduction, bringing it in above your foot there. Perfect. Any pain or discomfort doing so?
No.
Okay. So flex your hip too as well. So I would bring it up here, kind of flex it internal and external. Any pain there? Do the same with this one. Flexing it forward, internal, external. Perfect. And one of the specialty tests that we can do here while she's here is called the Patrick or Tabor's test. Kind of put the patient in somewhat of figure 4, and I will press down on her knee here. Are you having any pain or tenderness in your lower back?
No.
Okay. And I will do the same on the opposite leg for that test there. Next, we'll have you sit up. We're actually going to have you stand here in front of me. We'll turn this way, and I'm just going to inspect the back here. Here. And just inspecting the curvature of the back here. Also, just looking for any deformities. If a shirt was off again, I would check for any discoloration or things like that. I would palpate each vertebra, asking if there's any tenderness or so on palpation. Also, I'm looking for the symmetry of the shoulders, making sure one is not higher than the other, making sure everything looks fine there. Next, we'll do, we'll check for range of motion of the spine. So I'll have you come back towards me a little bit, and I'll sit right here in front of you and hold your waist there. And I'll have you bend forward, lean forward. Any pain doing so?
No.
Okay. And also, could you extend back towards me? Okay. Any pain there?
No.
Okay. Also, could you move laterally or lean to the left? Good. Any pain?
No.
Move to the right. Any pain?
No.
Okay, perfect. All right, you can have a seat again on the exam table here. I guess I did have you twist your shoulders there. One more thing, you just sit up for me. You kind of just twist at your shoulders, like, good. Any pain there? Okay. All right, perfect. Sit on the table there. I think we concluded everything. I'm just gonna do a double check here. Okay. Looks like we did everything for this musculoskeletal exam. Did you have any questions or concerns about the exam? Okay. Again, I thank you for your time.